when we have time. So, well, my talk is a bit of a departure from what you probably have heard in Cornea so far. And this is more about trying to use different kinds of technologies to be able to stay connected to your patients at all times. And this is something that we realized, obviously, during the COVID pandemic. So the sequence of what I'll speak to you today about is what we used to do typically before the COVID pandemic. I call it BC. What we are doing right now and what we will do after this hopefully goes away. So before, all of us are used to having access to a number of tools for imaging from the point of view of the anterior segment. You image them in all ways, even during surgery, and you do get a lot of data from which you can make judgments about a patient's condition and then make treatment choices. But during the COVID pandemic and even after, all of us have been confronted with lower numbers and also the need to reduce non-essential visits and also to help with remote examinations during this time. So at this time, we already had a system in our hospital where in the vision centers in the villages, the vision technicians used to take photographs using a slit lamp and then share it with the doctor in the tertiary center for diagnosis and for management. This system is working very well. So we wondered if we could actually apply this to the patient as well. So we created a teleophthalmology system where initially it was just making a phone call to a patient. Following this, we actually set up a system where we had a telecounselor calling patients and then interacting with the doctors. And after this, we created a web version of the same system. And the final version that we've been using for over a year right now, actually our anniversary was about last week, we set up a smartphone-based, app-based system. And all through, we've been trying to check if patients have had their issues resolved. And we found that 94% had complete resolution of their issues from the patient's perspective. And this is the app that we use right now. We call it Connect Care. And this is what the doctor has, where they can actually look at their patients' names, their appointments, their waiting list, and what is coming up for them, and has been much appreciated by doctors who use this. So we've seen that the peak of the teleconsultations that we had per month was during the time when COVID was at its peak. And then later when COVID started to abate, then the numbers seemed to come down. But then again, we've seen an upsurge with the second wave of COVID as well. And as of last month, we've completed in the last year, June to May 2021, over 80,000 teleconsults on this system. So how do we do this? We actually use the patient's history to tell us whether the patient has a condition that needs immediate referral, and if his vision is all right, and if he needs to come and see a doctor right away, or if he can be consulted online. We also ask the patient to self-assess from their symptoms, their vision, and also to look at the mirror and describe what they see in the eye. We've also done some research on visual acuity testing, and we evaluated several apps, and in fact published this in IGO a few months ago about the PEAK app that is very similar to your Logmar testing in the clinic. Next, we tried to get images from patients, and patients were sharing images on WhatsApp, like you can see here. And typically, these images were not good enough to make a diagnosis in all cases. Some patients started taking images on their phones that were really good, like you see here. And in some cases, the image actually mirrored what you would potentially see on a slit lamp photograph as well. So when we started to see patients who had more serious conditions like infections, graft-versus junction dehiscence, and also rejections, then we started to wonder if we could actually improve our diagnostic capabilities by looking at photographs from all patients. So we asked all patients to send us photographs on WhatsApp, but the problem that we were facing is most of these photographs were either out of focus, they're not in the frame of interest, lighting was not adequate, magnification was not adequate, and only 16% of these images were acceptable to clinicians. So we built a solution, a very simple solution, which is just a holder for a smartphone at a particular distance, depending on the focal length of the smartphone camera, and can be used for any smartphone universally. And this is a system that the patient's attendant can actually take a photograph with. And this comes along with an app on the phone, which helps you to focus and also helps to center the eye And the app also uploads the photograph that is taken to the patient's teleconsultation file. With this, we started to see that pictures started to become a little better. And then we started training the patient's attendants as well, spending 5 minutes with them on how to take pictures and sending them videos. And then we started to get really good pictures on the phone and photographs where we could diagnose corneal graft rejection as well. We also started to be able to see patients and their contact lens fit online. And eventually, when we started grading their pictures, we found that clinicians who are blinded graded more than 80%, 85% of these images as good as a slit lamp photograph. And we found that most of these pictures actually solved all the issues that we were facing with the smartphone. So since during our lockdown period, we found that our patients actually were seeking teleconsultation from across the country. We also thought that we should develop a portal, and we've done that just now, for EMR access to any doctor who would like to refer a patient to the hospital, and also a doctor who would like to book an appointment with LVP, and the doctor who would like to book time to consult a doctor at LVP. We also have set up a home care system where an optometrist travels to the home of the patient, and we've developed several devices like a wearable visual field device, like a wearable pupil measurement device, and also a mobile phone mounted topography device, using all of which the optometrist can capture images and then upload to the portal, and we can do a good teleconsult for the patient. So this is what we have learned and what we've set in practice in the last 1 year or so. Thank you very much.